These were normal factory workers who were hired to fix some equipment in a factory in Kisumu. And one of them fell ill, and therefore the factory took care and took the initiative and tested all those in that factory that had come in, including those that had come into contact with. And out of this, a few positives were identified. With that identification and having realized that they had traveled from India, sometimes before we locked or suspended flights from India, we went ahead and took the samples to CDC Kisumu, where sequencing was done, and indeed 8 were revealed to be bearing the very variant that is circulating in India, the B.1.167. We took the initiative and of course reached out to the county government of Kisumu and the county health management team. We locked down the institution and contact traced around the institution. We are still continuing to trace around the institution, those that have got into contact with. One of the considerations we have is that when the institution management realized that there had so many positives, they isolated the positives and continued then identifying more positive among those who had turned negative. Indeed, among those that had turned negative, about 50, another 8 turned positive again. So some good work was being done by the county disease surveillance team in Kisumu, and they are continuing to do so. And for those that we are continuing to identify, we are going to do genomic sequencing, so we want to try and curtail the transmission of that variant within the community in Kisumu. You may well be aware that there are other variants in the country. This is, I think, the public knowledge now. The UK variant, the B.1.1.7, the South African variant, the B.1.351, that have been circulating in the country since January. Known, of course, that especially for the UK variant, the so-called UK variant is the B.1.1.7. With the sequencing of our samples taken in Nairobi and surrounding counties, we've identified some coming from those who have no history of travel, meaning that the variant is circulating widely around us and within us. And that is why, as a ministry, we are continuing to urge Kenyans to continue upholding the containment measures. We all know that the variant is more virulent, is more contagious, and is more transmissible. So we are urging all of us, having known that the variant is here with us, to keep that vigilance higher. And as we continue sequencing and continue our surveillance efforts, urging all of us also to take care that we make sure that we don't get this variant circulating in Nyeri, for example, and in the communities. So the wearing of the masks, as was urged by the governor here, is still key to these containment measures and keeping these variants at bay.
The positivity rate still continues to go down. Out of 9,029 tests, 568 turned positive. That's a positivity rate of 6.3%. That is the lowest rate we have experienced in a long time. And we know that if we stay the way we are, if we continue following the rules na kufuata masharti ambayo sisi watu wa afya tumetoa, nafikiri tunaweza ona beleni hapo kidogo, we can see a light at the end of the tunnel. But I would like to emphasize that we are not out of the woods yet. We have still got new variants coming from different parts of the world. As you are all aware, now there is an Indian variant that is also approaching our borders. We have detected a few here in the country, but nothing to worry about, because these are situations that we have contained. However, it is good to be extremely careful and extremely vigilant, because we don't want to lose any people as a result of the new variants that are coming. We continue to have challenges as far as the vaccinating exercise is concerned. We have vaccinated so far some 911,515 persons. Therefore, we are heading to the 1.2 million doses to complete the doses that we have. As you are aware, we have got challenges because of the situation in India, but we have continued to fight through to ensure that we can get vaccines from elsewhere. But one of the key things that I would also like to urge is that where there is a slow uptake of the vaccine, because as you can see from here, we still have over 200,000 doses somewhere in the country, and those ones have been distributed in the counties. But we have also said that we will retake back the doses where there is a slow uptake of the vaccination. There are areas where there are counties we have distributed these doses, and there are counties that are slow at distributing and carrying out the vaccination process. Because we cannot afford to have the vaccines, because we cannot have the vaccines expire, we must therefore recapture and redistribute in areas that counties are slow at carrying out the exercise. We also want to remember in our prayers that we still have a total of 1,086 patients who are currently admitted in various health facilities across the country. We also have another 6,000 people and 381 patients who are on home-based care, who are being looked after by their families. And we want to remember all these people and ensure that our prayers are with them. We still have now down to 131 patients who are in intensive care units. You will remember about a month or just above a month ago, that figure had gone to 200 and almost 90 at some point. So it's also good that we are getting support from hospitals who have been very patient, hospitals who have worked diligently to save the patients who have been in those ICUs. We have got 28 of them who are on ventilators and 83 on supplementary oxygen. And we are hoping and praying that they get better. And so, my fellow Kenyans, I want to once again say thank you very, very much indeed. I want to ask for your understanding and for your patience as we combat the various challenges in healthcare that are surely going to come at us. But if we work together, understanding each other, I think we can overcome a lot of these problems. Thank you. The whole thing about COVID-19 is simply a new way of life. And this is something we have to come to appreciate, that it cannot be business as usual when it comes to COVID-19. As I said sometime at this time last year, if we treat this disease normally, it can treat us abnormally. That was true then as it is true today. And the fact is, as long as there are new variants coming into the country, and they will come to the country, no matter how much effort we put in, there is not a single country, unless you close your borders completely and allow nobody in and nobody out. That is the only way you can be sure. And even then, you never know. So as far as we are concerned, at MOH, we continue to urge you to be vigilant, because it is going to come. These new variants will come, and they will come. For example, the most dominant variant in the country at the moment is actually the British variant. That is not the one we started with as being the dominant variant. So we would like to ask Kenyans to really be careful. And when we contain an area, when we say, for example, in Kisumu, because they have contained the entire area, the factory, then the people must follow what they are being told. And that discipline is our saving grace in the fight against the deadly COVID-19 virus.